next condition we can look into is about the tonsillitis. So in simple, it is the inflammation of the tonsils. It is predominantly seen in children or in the growing adults, right? So here this infection may be caused due to any streptococcus, staphylococcus and Haemophilus influenza. These are the certain organisms which leads to tonsillitis. And coming to the general signs and symptoms or manifestations, it starts with sore throat or mild pain in the throat, and later the patients have or the client will experience difficulty in swallowing. It's called as dysphagia, and later they'll have fullness in their throat. So as the infection continues, or if it is not properly treated, it can cause fever, general malaise, and also the client will experience severe throat pain. Simultaneously, pain in the ears, jaw is also experienced by the client. And similarly, when we check or when we go for the physical examination, we can see the reddened tonsils which are surrounded by mucopurulent tissue, or it is surrounded by mucus filled with pus or mucus combined with pus. The main goal or the treatment which we give for tonsillitis is, first of all, we have to give them proper education about tonsillitis and also give them analgesics so it can reduce pain. And also we can administer antibiotics such as penicillin. If the clients are allergic to penicillin, then we can administer azithromycin or erythromycin for a week or for 7 to 12 days. Coming to the complications of tonsillitis, mainly it leads to chronic tonsillitis, which is also called as peritonsillar abscess, and it can also spread to other parts and cause acute otitis media, subacute endocarditis, and also it can cause glomerulonephritis. So these are some of the fatal complications that can be caused due to this type of tonsillitis. Next, let us see about chronic tonsillitis. As I've already mentioned, when the acute tonsillitis is not treated, when there is a recurrent occurs of this infection, that can lead to chronic tonsillitis. It is also called as peritonsillar abscess, which is mentioned as quinsy. So coming to the manifestation of this chronic tonsillitis, they'll have irritation in the tonsillar area or in the throat, difficulty in swallowing, along with the fever and chills. And coming to the management, we administer antibiotics, and if it is chronic tonsillitis and if it is mandatory that the tonsils has to remove, then they go for the surgical approach that is called as tonsillectomy. Ectomy means removal. So the removal of the tonsil is called as tonsillectomy, and that is a surgical approach we go for the chronic type of tonsillitis. So I told that tonsillectomy is the removal of the tonsils. It can be done through various procedures or various methods. So among that we will see few methods. In that, the first one is using cold knife technique or using the dissection method of using scalpel and cauterization. They'll be using this method in removing the tonsil. And second one is using cauterization method. Cauterization means burning the tissues. And when we remove the tonsil, sometimes there might be severe bleeding. So we go with this cauterization method where the blood vessels which are ruptured are being clawed or burnt so that the bleeding might not continue. So we can maintain the hemodynamic status of the client. And other types of methods used are radio frequency ablation methods, carbon monoxide methods. All these methods are used to remove the tonsils. Coming to the nurse's responsibility, always try to position the patient in supine position, try to elevate the head end of the patient using a rubber ring or keeping a cloth under the head, and also check the hemodynamic status of the client and also monitor the respiratory status of the client. Along with that, you also have to try to see what is the hydration status of the client, whether he is able to maintain his hydration levels. All this should be monitored as nurses. Some of the nursing diagnosis and the intervention we can plan for a post-operative tonsillectomy client is risk for aspiration, or they have difficulty in breathing, swallowing, right? So as nurses, we have to monitor their vital signs, try to check their temperature every 4th hourly, monitor the respiratory rate and also the pulse rate. So this gives us an understanding about the baseline data of the client, and try to check for any bleeding or any discharge from that incision site, and also check for the client's hydration status consequently. Another common diagnosis which we can frame for the clients with tonsillectomy is fluid volume deficit. So what are the nursing intervention we can provide? So after the surgery, it is always good to start with the cold fluids or ice creams. So this will help the client to have a good relief, and after 4 to 5 hours of surgery only we have to start the soft food or soft type of diet like ragi porridge or any other soup, which can be helpful. And after 24 hours they can plan for a regular diet, and even after 24 hours the client can be discharged. And the last type of diagnosis is risk for infection. So if not maintained proper sepsis, this can lead to various other complications like otitis media, and it can spread to many other parts. So in order to avoid that, as nurses we have to maintain the asepsis in the ward or in the post-operative setting, as well as we have to give them the education as they go home. If they have any aspiration or any bleeding or any other discharge, they have to come for the follow-up care and also take suitable treatment for that discharge. The next condition is laryngitis. Laryngitis means the inflammation of the larynx. Hoarseness is the common symptom which we can see in clients who have laryngitis, because the vocal cords are involved and there will be a huskiness of the voice or the hoarseness of the voice. So it won't look like a original voice of the client. So that is why it may be due to the formation of any tumor, benign or malignant tumor over the vocal cords, or the causes for this laryngitis may be verbal overuse, or using the vocal cords for a long period of time can lead to laryngitis. Bacterial and viral infections can also be a causative reason for this laryngitis. It may be due to streptococcal agents or pneumococcal agents, Haemophilus influenza, chickenpox, whooping cough. All these are the common reasons that can lead to laryngitis. And one more reason for this laryngitis is due to inhalation type of burns. If they have inhaled any toxic substance, or if they have swallowed any toxic substance, also can cause this type of laryngitis, which may damage the vocal cords. Coming to the signs and symptoms, as I've already mentioned, there will be the hoarseness of voice or huskiness in the voice, along with the pain in the throat, tickling sensation in the throat, and voice changes. And coming to the treatment is, we can start with antibiotics if it is caused due to any other organisms, microorganisms, and we have to try to remove the underlying cause that is causing laryngitis. For example, if it is the abuse of the vocal cords or using the voice for a long period of time, then we can advise the client for rest for their voice. So coming to the treatment of this laryngitis, which is applicable for both chronic laryngitis also, we have to treat them with the antibiotics and also mucolytics, which helps to avoid the excessive secretion of mucus, and also esophageal reflex such as antacids can also be given to reduce the or to give relief to the patient, and voice rest is also very necessary to avoid more complications to the larynx.